Everything that is distinctly human about our behavior has been learned, such as language, how we dress, how we reach our goals, etc. Our individuality depends on learning, or the process of acquiring new information. Memory, or the ability to store and retrieve that information, also plays a role in how we form individuality. There are fundamentally different types of memory, each relying on varying networks of brain regions. Functional perspectives on learning and memory. We can learn a great deal about learning and memory by examining how they fail in clinical studies. These case studies reveal that learning and memory fail in very different ways, indicating that there are different forms of memory and that multiple brain regions are involved. Using animal models and brain imaging, researchers are generating a comprehensive picture of the brain mechanisms of learning and memory. We cannot be sure that learning occurred unless a memory can be elicited later. Many kinds of brain damage can produce highly specific types of memory impairment. For patient HM, the present vanished into oblivion. Amnesia is a severe impairment of memory and is usually seen as a result of an accident or a disease. Retrograde amnesia is the loss of memories that formed prior to an event, meaning that you have difficulty retrieving memories formed before the onset of amnesia. It is very common, however, it is unlikely that longer-term or complete retrograde memory loss has ever occurred. It's typically seen in regard to events that happened a few hours or days before the incident. Anterograde amnesia is the inability to form new memories after the event, or the inability to contain new material for more than a brief period of time, and this type is more unusual than retrograde. In other words, it's the inability to form new memories beginning with the onset of a disorder. Patient HM suffered from anterograde amnesia. His short-term memory was normal, as he could repeat a list of numbers back immediately after they were said. However, if a different task interrupted HM reciting the list, he could not recall what was said, let alone even remember that there was a list. HM's case provided clear evidence that there is a difference between short memory and long-term memory. HM's memory deficit seemed to be caused by loss of the medial temporal lobe, including the hippocampus. Patients with the same type of damage to the amygdala but less damage to the hippocampus do not exhibit comparable memory impairment. When given a mirror tracing task, HM improved considerably over 10 trials, yet when given the task the next day, Henry did not report remembering the task. However, his performance on the following day was better than at the start of the first day, showing evidence of memory in the form of motor skills. The important distinction between types of memory is not verbal and motor performance, as some people with amnesia can learn the skill of reading near reverse text, but show impaired learning of specific words. Instead, there are two general categories of memory. Declarative memory, which is a memory that can be stated and described. It includes facts and information acquired through learning, and it's what we typically think of as memory. We are aware of accessing this memory as we can declare it to others. This was profoundly impaired by HM surgery, and we use this type of memory to answer what questions, as it is tested for by asking for specific information that has been previously learned. Non-declarative memory is a memory that is shown by performance rather than by conscious recollection. This is also called procedural memory. Memory about perceptual or motor procedures such as the mirror tracing task or riding a bike are examples. This answers the how question, as this type of memory reflects things you learn by doing. It's often but not always nonverbal memories. To get around the inability of lab animals to verbally report their memories, researchers developed the delayed non-matching sample task, which tested object recognition memory. In this task, monkeys must identify which of two objects was not previously seen, with delays ranging 8 seconds to 2 minutes. The important feature of this test is that the animal does not reach for the object that previously had a tree under it, but instead reach for the object that was not associated with the tree. By reaching for the other object, the animal is declaring that it remembers the object by reaching for the other object. Reaching for the object that previously had a tree under it might show that the monkey unconsciously associates reward with that object, even if the animal had no conscious recollection of it. Monkeys with extensive damage to the medial temporal lobe, and thus similar to HM, are severely impaired on this task, especially with longer delays. Specific removal of specific parts of the medial temporal lobes revealed that the amygdala was not crucial for performance on declarative memory tasks. However, removal of the adjacent hippocampus significantly impaired for performance on declarative memory tasks. This deficit was even more pronounced when the hippocampal damage was paired with lesions of the entorhinal and parahippocampal cortex. Deficit became even more worse when lesions of the parahippocampal cortex were added. Humans similarly show larger impairments when both hippocampus and medial temporal cortex are damaged, confirming that HM symptoms resulted from the loss of the medial temporal lobe on both sides of the brain. One idea about declarative memory holds that two interwoven processes are involved in how they form. Recollection of the items in the specific context in which they were presented, which is a function of the hippocampus, and sense of familiarity with the features of the recalled item, which is carried out by the parahynal cortex. Processing of the contextual aspects of memory appears to depend on the parahippocampal cortex. People with specific hippocampal damage appear to have difficulties with recollection, while familiarity-based aspects are not affected. In contrast, people with surgical lesions to the parahynal cortex but not the hippocampus experience impaired familiarity with stimuli, while recollection is kept intact. Patient NA was a patient who was unable to encode new declarative memories due to damage to the dorsal thalamus and mammillary bodies. Injury to the brain was sustained by having a miniature sword stabbed through his nostril. He was left with anterograde amnesia, mainly for verbal material. His memory for events leading up to the sword incident was near normal. Showed normal short-term memory but was impaired in forming declarative long-term memory. MRIs show that the sword damaged several aspects of the diencephalon and that have connections to the hippocampus, especially the dorsal medial thalamus, both mammillary bodies, and possible damage to the mammillothalamic tract. A mammillary body is one of a pair of nuclei at the base of the brain that connects the hippocampus and plays a role in memory. Korsakoff syndrome is a memory disorder related to thiamine deficiency, generally associated with chronic alcoholism. People with Korsakoffs frequently deny that anything is wrong with them, and they often confabulate or fill in a gap of memory with a falsification that they seem to accept as true, such as saying that someone stole your glasses when you really just forgot where you put them. Temporal lobe structures, including the hippocampus, appear to be normal in people with Korsakoffs. However, mammillary bodies appear to be shrunken and diseased as a result of bleeding and cell death. Some damage to the dorsal medial thalamus also appears to be evident. Damage to the basal frontal cortex probably causes the denial and confabulation that differentiates people with Korsakoffs from people who have amnesia. Treating people with thiamine can prevent further deterioration of memory functions, but it will not reverse the damage already done. A brain circuit that involved the hippocampus, mammillary bodies, and the dorsal medial thalamus is needed to form new declarative memories, yet declarative memories are not stored in these structures. This is seen in patient KC, as he was a patient who sustained damage to the cortex that rendered him unable to form and retrieve new episodic memories, especially autobiographical ones. Brain injury was sustained in a motorcycle accident, and although he was unable to retrieve any personal memory of his past, he had a good general knowledge. This is what is called episodic memory, as it is memory of a particular incident or a particular time and place. Semantic memory, on the other hand, is generalized declarative memory, such as knowing the meaning of a word without knowing where or when you learned that word. Casey could acquire new semantic knowledge, but not new episodic knowledge, despite knowing that he had a past. Brain scans of Casey revealed extensive damage to the cerebral cortex and severe shrinkage of the hippocampus and nearby parahippocampal cortex. Casey had retrograde episodic amnesia, which may have been a consequence of the extensive damage to his frontal and parietal cortex. The different types of non-declarative memory depend on different neural systems. Non-declarative memories shape our abilities and responses to the world around us in ways that are difficult to express, but no less crucial for survival. Virtually every species of the animal kingdom seems capable of some sort of declarative memory. Skill learning is when participants learn how to perform a challenging task by practicing it over and over again. This requires motor coordination. An example would be the mirror tracing task. Different skill categories include sensory motor skill, which is seen in mirror tracing, perceptual skills, which is learning how to read mirror reverse text, and cognitive skills, which is seen in puzzles, which involves planning and problem solving. All three kinds of skill learning are impaired in people with damage to the basal ganglia. Damage to other brain regions, especially the motor cortex and cerebellum, also affects some aspects of skill. Priming is changing in the processing of a stimulus, usually a word or a picture, as a result of prior exposure to the same stimulus or related stimuli. This is also called repetition priming. An example would be being shown the word stamp in a list and later being asked to complete the word stem STA, resulting in you being more likely to reply stamp than a person who was not shown the word to begin with. Priming does not require declarative memory of the stimulus. Perceptual priming, or priming based on the visual form of words, has been related to reduced acuity in the bilateral occipitotemporal cortex. Conceptual priming is priming based on word meaning and was associated with reduced activation of the left frontal cortex. Components of the medial temporal lobe memory system, especially the parahynal cortex and hippocampus, are also involved in some forms of non-declarative memory in addition to declarative memory.